Liberia, Africa's first and oldest modern republic. Founded in 1821, the country offers a vast assortment of beauty and is a pioneer for Africa in many aspects. However, healthcare is not at the top of the list. Liberia has taken many steps to transition from an emergency health system to a functional decentralized health system. Civil war, geographical barriers, and the recent outbreak of Ebola have prevented them from achieving this, though. Liberia has heavily relied on countries like the United States and health organizations to combat against these problems. We interviewed Samson, who grew up in Liberia, to ask about what improvements could be made to the Liberian healthcare system.
I think we need more educational programs about educating people about the basic sanitation needs, what they need to do. For example, using the restroom and then finish washing your hands and then doing all the little sanitation stuff. People need to be educated about that. I also think we need more access to affordable health care. Like there are not many hospitals and clinics in most of these counties. I mean, some people have to walk for miles or travel from a very long way just to come to the major public hospitals we have in Liberia. So I think that is a major concern, and I think that's something that need to be addressed by the government or maybe international aid organizations. So.
Liberia recently emerged from a civil war that obliterated nearly 80% of medical clinics across the country. This resulted in nearly impossible access to healthcare, especially for people of rural areas. Programs such as Rebuilding Basic Health Services are striving to reconstruct the 330 medical clinics and equip them with more health professionals and medications. Most healthcare facilities in Liberia are funded by national and international non-governmental organizations, with payment partially dependent on performance and how readily accessible they make healthcare. Some clinics and hospitals are free of charge to patients, while others require an out-of-pocket fee for service. There is only one recognized school of medicine in Liberia. It has a maximum capacity of 125 students and currently has two schools, the College of Medicine and the School of Pharmacy. Students are in school for 5 years plus a 2-year internship. There is no accredited specialty residency training available in Liberia. Doctors, medical school staff, and students had to flee the country during the Civil War, and hospitals were raided and destroyed, which resulted in an even bigger setback in healthcare. The majority of people in Liberia do not have access to Western medicine. In fact, many people believe that illness and death are caused by the evil intentions of other people and other metaphysical causes. There is also a traditional belief that misfortune in people's lives, whether health-related or not, comes from God inflicting punishment on them for indulging in sinful activities. Because of these beliefs, spiritual healers are often consulted for treatment instead of doctors and healthcare professionals. However, modern healthcare practices are being implemented more often now. Civil conflict and prolonged regional instability have displaced thousands of people as refugees. Healthcare systems in Liberia are highly dependent on support from agencies and non-governmental organizations. They implement more than 90% of health service delivery. More than 75% of the population has no access to referral care services. Liberia also has some of the highest infant and maternal mortality rates, and childhood malnutrition is high. HIV/AIDS is prevalent as well. The lack of information and services has made it hard to control diseases. Just as the country began to rebuild its broken system from the setback of war and lack of resources, Ebola came in and stunted these efforts. As the president of Liberia, Ellen Johnson Sirleaf states, "This is a huge hit for a country that had barely 50 doctors to care for a population of 4.4 million at the start of this outbreak. More than ever, we will rely upon assistance from partners such as the United States and Britain and global health organizations to help rebuild our health systems." Liberia has been on the road to recovery for quite some time now, and it seems as though that road is not going to come to an end as soon as we would hope.